Hi, I'm Laura Esfeller. I'm a patient advocate with the Kidney Cancer Association, and I'm here today with Dr. Shuchi Gulati from UC Davis, who's going to be talking with us about her recent study on wildfire exposure in kidney cancer. Is that correct, Dr. Gulati?
Correct. So, as you know, I practice in the state of California, where wildfires recently have become a huge issue. They are becoming more and more rampant as time is going, so there's been a lot of interest in trying to understand if wildfires indeed do have an impact on the survival or outcomes related to cancer. We have certainly seen a lot of that. A lot of that has been reported in, say, airway cancers, lung cancers, because obviously PM 2.5, which is the fine particle that's present not only in wildfire, also ambient pollution. It's an inhaled particle, so it makes sense that maybe there's more exposure in the aerodigestive tract and you have increased risk of developing respiratory cancers. But what's interesting to me is that there's been recent research, and people are now finding out that these PM 2.5 particles can also cross through the capillaries of the lungs and into your blood circulation, and so that means it can go anywhere in your bloodstream. And so I was basically interested in trying to see if wildfire exposure indeed has an increased risk of death or dying from cancers related to the genitourinary tracts, and kidney cancer being my research focus, I decided to focus on that. And the inspiration also comes from one of my patients, actually, he's a wildfire fighter, and he came to my clinic with bladder cancer, and he had 3 prior cancers before that. So he actually encouraged me to look at this data, and he asked the question and posed the question to all of us, like, is there something in wildfire that's making me have so many cancers? So it started with that basic conversation in clinic.
That's incredible.
Definitely, we learned so much from our patients, right?
Absolutely.
So that's when I looked at CCR. So California Cancer Registry is a unique resource because it gathers granular patient-level data. I think it's one of the most comprehensive registry in the country. Of course, if you collect the whole country's data, that's a larger number, but for a state, I think this is one of the most comprehensive registries. So we looked at patients who had been exposed to PM 2.5 between 2017 and 2022. And if you remember, 2020 was one of the worst wildfire seasons in the history of California wildfires. So that period was included in the period that we were looking at. And then we excluded patients who did not have at least 1 year of survival after the diagnosis, mainly because we thought patients who are dying within a year maybe have very aggressive cancers or other comorbidities, and so maybe it's not PM 2.5 that might be contributing to their survival. Maybe they have other things going on, so we did not include those patients. After forming our cohort of patients, we looked on how to measure PM 2.5. So for that, I actually rely on the Air Quality Research Center at UC Davis. I'm not the expert in that, but they have granular data on PM 2.5 exposure in all these patients who are enrolled in the cancer registry up until 2022. So we looked at this data, we classified patients demographically, and as you can see, we had around 22,000 cases. And this is just a demographic distribution of the patients. What is interesting and what I wanted to point out here, these are 2 different wildfire seasons in the state of California. This is from 2019. And here I've listed the exposure parameters, and the very high exposure in 2019, 0 patients were exposed to any wildfire PM 2.5, which makes sense. But in 2020, it was close to 4,500 patients. So that's how we know that this data is definitely true. So then we have looked at the incidence of all cancers, and we do see an increased risk pan cancers. But what I was mostly interested in for this project was to look at the survival data, mortality. So we basically looked at, so if you see here, the total number of patients is 21,000, and there were 2,300 deaths. This is all kidney cancer only now. So the hazard ratio is 1.22, which means after we adjusted for all the confounders, known confounders that could potentially affect outcomes of kidney cancer, when we increased the mean annual exposure of PM 2.5 by 10, the hazard ratio of death, or the hazards of dying from any cause, not just kidney cancer, from any cause, increased by almost 22%. And this number was significant, as you can see here. We also stratified this cohort by tobacco use, BMI, and whether patients were on systemic therapy or not, because these are some of the known risk factors. And upon stratification, it's really interesting that patients who didn't have prior tobacco use, patients who had a BMI less than 30, and patients who were on systemic therapy, all these groups also had an increased hazard of dying from like an all-cause mortality increase.
So even not having some of those kind of, typical risk factors, they still had, a poor outcome, it sounds like.
Exactly. And then I also, and that's going to be at the oral session, because we further did some sub-analyses where we looked at whether the number of days of exposure to certain levels of PM 2.5 made a difference. And what's interesting is we saw that like all levels, 9, 35, like we took these levels, looked across the board. If I increase the number of days of exposure by 10 for each of these levels of PM 2.5, does that impact the outcome? So the mortality did increase for all the numbers, except what was interesting is that the very high level, the 55 and above, that patient population actually had a reduced hazard of dying. And that actually supports my hypothesis of maybe because when there's very high levels of PM 2.5, we tell our patients to use masks or, don't get exposed, or people move sometimes because they don't want to be in that area. So I think seeing a reduced mortality in that very high exposure group actually supports the hypothesis that there is something related to PM 2.5 that might be impacting the outcomes. And then I also compared survival. This was the final analysis to look for if somebody had less than 10 versus greater than 10 days of moderate PM 2.5 exposure. And we looked at the 25th quartile mainly because at the 50th, the median survival was not reached for either groups. So I looked at the 25% quartile survival time, and it's definitely shorter for patients who had more than 10 days of exposure of PM 2.5. So it's like 9.7 versus 13 months, and it's significant by p-value also.
And then Dr. Gulati, so PM 2.5, does that also include like smog and all the other unhealthy air quality issues that we typically face in California?
It could, yeah, because PM 2.5 can certainly be present in like ambient air pollution also. But I think the very high levels, especially above 35, which is why we chose that number to do the survival analyses, that's usually associated with wildfire.
Okay. So as we saw earlier this year, unfortunately, the wildfire problem in California and across the country isn't getting any better. So what do you feel like are some takeaways for patients and providers whenever they're thinking about their risk exposure, environmental risk exposure, and how it relates to kidney cancer?
Yeah, that's a great question. I think clearly we've seen that there are worse outcomes in patients who are exposed to wildfire PM 2.5. So while we are trying to understand the mechanisms behind why the survival or why the mortality is worse in that group of patients, I think the best recommendation I have as of now is to prevent exposure. Like if you can wear N95 masks or not be exposed to high levels of PM 2.5. Of course, sometimes it's unavoidable. Like we can't tell everybody to move, leave their homes and move. But I think avoiding exposure is the best strategy right now. And as far as us, like translational investigators, I think it's on us to try and understand mechanistically if all of this makes sense, if there are any modifications specifically in their lifestyles or systemic therapies, for example, that we can recommend. That all remains to be explored. So this, overall, it's very exploratory, but since we have large numbers, it does support our hypothesis that exposure to PM 2.5 not only impacts respiratory outcomes, respiratory tract cancer outcomes, but since it goes into your circulation, it can certainly affect outcomes related to other cancers. So we'll continue to work on this. Hopefully, as the data evolves, we'll have data from the most recent wildfire also, and hopefully we'll publish this and make people more aware of the available data.
Absolutely. Thank you, Dr. Gulati. I know I will be continuing to wear my N95 mask whenever there are wildfires in California, and appreciate your also sharing your patient's impact on this research.
Of course. Thank you so much for stopping by.
Thank you.